Strategic Health Services webinar, Change Plans, Change Lives. If you have attended one of our webinars before, this is a continuation of our Employee Wellness and Hospital Reseller series. Today, we dive deeper into our wellness solution, discussing our newer assets, as well as taking a look at the role and impact of claims analytics. I'm Cara Tarantino, the Director of Marketing with Strategic Health, and in just a moment, Susan Plumer, our Vice President of Health Sales, will take you through our presentation. If you have any questions during the next half hour, please type them in the sidebar and we'll follow up with you after the webinar. There are also two handouts in the sidebar, one that details our program, and for everyone attending today, spouses are free if you sign in 2016. The other handout details our new challenges and UtiliFit program, which Susan will go over. With that, I give you Susan Plumer.
Thank you, Cara. And thank you for everyone who is participating in today's webinar. So before we get started on the three things that really drive impact for wellness programs, I just wanted to touch upon the market that Strategic Health Services focuses on. So as you can see up here, there's really four markets that we are focused on. And first and foremost, we really focus on the hospital and selling our wellness platform to the hospital employees. We like to have the employees deployed first because that's the proof pudding model, and then as that program is successful, we help those hospitals private label that program and sell it to the employers in their community. So it is the SHS wellness platform that is behind the scenes, and the hospital is using that as a catalyst to go out to the community to sell wellness as well as their other services. We also work very closely with brokers and TPAs as they can resell this to their customers as well, and this can all be private labeled. So what drives impact? So as Cara said, for some of you that have been on the SHS webinars, this will be a deeper dive into the SHS platform, reporting, and communications tools. And for those of you who have not attended the webinar, this will really illustrate the importance of having a robust engagement platform, how coaching can help drive your claims down, and how important effective communication is in deploying a wellness program. From understanding your population, the barriers to health, to publishing member success stories that really inspire the population. So these are the three things that we're really going to focus on in today's webinar. So what I'd really like to start with is to show you the results of putting all these three tools to work. So meet Latasha. Latasha works for Custom Design Benefits in Ohio. And when her company introduced the wellness program, Latasha was 65 pounds heavier. She was pre-diabetic. She had sleep apnea. She didn't eat healthy, and she smoked. So through the program from SHS that Custom Design Benefits put out for their employees, Latasha started she went into her portal, which is the Pathway to Health. She took her HRA, she did her biometric screenings, and then she was assigned a coach based on her results. Now, it's important to note that wellness is not the same for everyone. Every employee needs something different. They need a different program and services, which is why it's so important to have a coach working with that individual and linking them to the right programs and services. So for Latasha, she went to see her primary care physician because she was in the obese category. She enrolled in the SHS weight loss program and smoking cessation program. And the more Latasha became engaged in logging into her portal, using her trackers to measure her food and exercise, the more she participated and the better results that she saw. So at the end, Latisha lost over 65 pounds. She eats healthier. She has introduced healthier foods to her kids. She quit smoking. And for the employer, Latasha is going to cost that employer a lot less money. So you can see the overall impact on the individual and the employer. And if you were a hospital reseller, these would be some of the services that you would be able to bring out to those employers, because you'll have your own weight loss program, you'll have your own smoking cessation program, as well as you may have a sleep clinic that you're going to send Latasha to for her sleep apnea, and you will have a brand new patient because we're connecting her to your primary care physician. So next, let's talk about the importance of a robust engagement tool. Ours is called My Pathway to Health. We really believe that the journey to health is a 3-year journey, and we think that it should start with having some fun. So we have recently partnered with a company called Fix out of Atlanta that has health entertainment, and I'm going to talk a little bit more about that in the presentation. But this will bring activity challenges to your employees individually as well as company-wide, and it's specifically designed for employees that may not be at a desk every day, so that they have push technology to those employees via the portal and via smartphone technology. So the key to really engaging in a platform is making it easy and have anywhere, anytime access, and being able to use the devices that you already currently use. We don't want to have everyone change from what they're currently doing. So SHS has a strong integration with many devices, consumer devices and applications like Fitbit, like Garmin, like Lose It. So whether it's exercise or nutrition, all of those applications that people may be using are automatically updated into our portal. So every day that they log into the portal, they can track their steps, their calories, their food. The other thing that integration does is we can integrate with clinical devices like a blood pressure cuff, like a blood sugar monitor, like a health monitor. So as hospitals are sending individuals home, they'll be able to update, get those updates in their portal on a daily basis. So these things really help drive engagement and help your members really interact with this tool. The personal health record is something unique to SHS. This is where an individual can track all of their physician appointments. They can track their medications. Often when a individual has to go meet with a physician, they're bringing in bags of prescription drugs to be able to show them what kind of medications they're on. But with this tool, they can just print out their personal health record. They don't have to bring in bags of medication, and they can track all of their appointments in one place. Claims analytics is a very important part of wellness. It drives coaching, it drives intervention, and it drives wellness. We are going to spend a bunch of time later on in the presentation and talking about the coaching impact of claims. But this is something that also that populates your personal health record. As we get the claims information in, that data goes right into a person's personal health record. And incentives obviously are part of what drives a wellness program, because as we all know, people don't do anything for nothing. So being able to tie your incentives into this program, our portal has 15 health trackers that are tied to a scorecard, so we can help you design your point structure. We can report on that so that you can know what employees are doing what, and we can know where to focus the engagement on, and that it also helps you from an administrative perspective as you're doing your premium differentials and your rewards. All of that all of that data is in one place. And then lastly, when you as an organization, especially a hospital, decide what information is what we call clinically relevant that you would like to push out to your physicians, our portal has an open architecture that can work with any of your EMRs. So what I'd like to just talk a little bit more about the health entertainment that we are bringing to our clients. So on the left-hand side here is what we call UtiliFit. This is used to encourage employees to complete short, low-impact exercises throughout the day. So every hour, every day, you get a text message or an alert on your portal to complete the challenge. And it can be push-ups at your desk, it could be lunges, it could be just stretches, but this is really made for activity. We all know that, you know, sitting is the new smoking, so we want to make sure that your employees are getting up and doing something. On the right-hand side is what we call our Step Ahead Challenge, and this is a walking challenge unlike anything you've ever experienced before, and this is available in both 6 and 12-week formats. Teams will have to work together if they want to avoid being turned into a mind-controlled alien. So the Step Ahead is a step-focused challenge where tracking healthy diet and exercise really provide an extra boost in the game. So that is something that is going to be available as part of the SHS platform in June, and the Step Ahead challenges are available today. So let me just show you a little bit about our portal and the highlights that our members like to really use. So we're able to measure progress. There's to show how quickly that you're meeting your goals from your action plan. There is a My Action Plan that is a goal setting tool that you work with your coaches. We have monthly newsletters that are available for our members. A lot of those are tied to the monthly observances like Breast Care Awareness Month or Heart Disease Month. And then it's really important that folks can use this on the go, and it's available on your smartphone and can sync with several devices. Next, what's important to note here, this is our portal, but you'll see in the left-hand corner that this is one of our customers. All of our portals are private labeled to your company or to what your wellness program is called. So this is your program for your employees, and if you are a hospital reseller, this would have their name on it as well. We do have 15 different trackers here that a lot of our members sign into every day so that they can track how many calories they've burned and how many steps they've taken. They can enter their blood sugar and again, blood pressure, and if they have those blood pressure cuffs and blood sugar monitors, that's updated immediately as they log into the portal. So our wellness process really sets us apart. You know, most wellness programs, the members are just really completing an HRA and a biometric screening, and they're really not doing anything with those results. Those results just sit there. So unless you're having actionable data, there's really nothing that is going to motivate a member to get healthier. So our HRA and biometric screenings combined create a personal health profile. This personal health profile is a 27-page detailed report of the results of the HRA and the biometric screening. It gives them recommendations based on those results, and it also, this is the first opportunity for coaching, so a coach can make an outreach call and talk to that member about what their biometric screening results even mean. You'll be surprised, even for those members that work in hospitals, that they really don't know what LDL and HDL is, or they really don't even understand that high blood pressure could lead to a stroke. So these are risks that are discussed up front with members, and then gaps in care as they are identified in claims, those members that haven't had, women who haven't had mammograms, those are all identified, and again, a big opportunity if you are a hospital reseller to start engaging with those employees. So where do the claims reduction come from, and how does coaching impact that? I'm going to show you. I really like this slide because this is just to set this up a little bit, because this is self-reported data versus biometric data. So as you can, it really shows you what your perception of your employees are versus what real data shows you. So here you have 3 different companies. One is a trucking company, one is a food service company, and one are hospital employees. And as you can see here, the perception, the grayed out area is their HRA data, okay? And so the HRA data, according to the HRA, only 5% of those members in the trucking company think that they are at risk for diabetes, and 6% in the food service and 5% in the hospital. So the reality after those biometric screenings have been taken is it's a lot higher, significantly higher, and we know that each of these members that are pre-diabetics cost an employer over $12,000 a year. So it's really, really important to have that real data and that biometric data, so that people can, so that coaches can start targeting those individuals, and we can really make an impact on your claims. And the claims data really shows us a lot more information. So let's start with this aggregate member information. And here on the left-hand side, obviously it's showing you, the number of people in your employer group, the average age, what percentage is male and female, and the number of employees that are involved in some kind of a case management or care management, usually through the insurance company. But on the right-hand side here is your average forecasted cost, and this is what you as an employer are forecasting to spend, have forecasted to spend over the last 12 months per employee. And so what you can see here is that this is your forecasted and this is your actual. And the actual should be less if you are using a program that has these targeted interventions through coaching. And that's what we're able to show here. And this is an employer that has only been using the program for less than a year. So as the years go on and as the coaches become more involved, you'll see a greater impact in their actuals versus forecasted. So the next thing that I would really like to point out here is the motivation rank. This is how motivated the member is to make change. And there's all kinds of calculations and methodologies that go into how you're motivated. One of the things that we like to say is that the employee that has had a heart attack, the day that he walks out of the hospital is the day that he's most highly motivated to make a change. But we are able to see each individual and their motivation rank, and that is where we are going to target. We're going to target those individuals because we know that those individuals are ready to make a change, and we want to make sure that we help them. The claims information will also show what we call in the industry as movers, which are the top 10% of your expected high claimants. So we also target that population with our coaching because we know that that's where the dollars are expected to be spent. So this analysis, this risk score movements, this analysis is really based upon your employee risks assigned from when they've taken their HRA and their biometric screening. This is based on a cohort population over a 2-year period of 1,000 employees. And once that biometric and HRA has been taken, those members are stratified into these 5 categories: healthy, low risk, emerging risk, high risk, and chronic risk. And based on those categories, they are assigned a coach. And our coaches are ranged from nutritionists to exercise physiologists, dietitians to nurses. And those coaches are assigned based on that risk, and they work with that member throughout the entire program. Now, if you are a hospital, you certainly have the ability to use your own coaches that could work with your population as well. But as you can see here, we're obviously focusing on the got better and the percentages of these categories that have gotten better. But the one thing that I would like to point out is we tend to ignore our healthy because we think they're healthy and they don't need help. And as you can see, 8% of this population, of the healthy population, got worse. That's probably because the employer wasn't focused on the healthy. So we need to understand that it's important to keep those healthy. Next here, we have a compliance report. And so this really shows whether or not a member who has a chronic disease is getting all the tests that are recommended by the American Medical Association. So here you can see, this is the disease category. You see the number of members that have these diseases. And then you can see in 2015, how many in your population are compliant with the tests that they need to take as part of these programs. And this was a year-to-year, 2014 to 2015, and obviously through the program and through the coaching and people working with the people with these diseases have been able to make sure that these individuals are being more compliant with the tests that they need to take that go along with this disease. The other thing that is notable about this is that this is where your gaps in care come in. So you'll see, and let's just take your women for example, that only 35% of your women are compliant in their preventative care. So that means they may not have seen a primary care physician, they may not have had a pap smear. We will be able to tell the women over 40 that haven't had a mammogram. So these are the kinds of folks that our coaches are going to be able to target. And then lastly, you'll see that this is the average compliance, national average, and that these individuals in our program are over and above what the national average is. So this slide is really where the rubber meets the road here, because this is really the impact on cost through coaching. So these are all actual members that we have worked with. And so it lets you know the diagnosis that they have and that what their actual claims were in 2015. So we'll take this cardiovascular member and what their forecasted cost is for 2016, and there is a significant change in what they're expecting the claims to be based on the outcomes of all the coaching work that's been done by our coaching. So two things to note here. One is this employer is looking to save over $500,000 in claims because of the coaching program that they put in place and the targeted interventions. And secondly, as I talked about the motivation rank, you see that most of these individuals were in a highly motivated score. So that's where we targeted, and that's due to the high results. So lastly, a program cannot be adopted and engaged without proper communications. So the first thing that I like to talk about here is the importance of understanding your population and their barriers to health. And this also, by doing a survey with your employees, will help drive what you need to put in for incentives. But getting to know your individuals and the things that might be in their way or what motivates them is an important part of how you put your program together. And I'm going to give you a couple of examples. So we have worked with an organization where they have had just terrible compliance with mammograms. So talking to women that are fully insured and that don't get go get their mammograms on an annual basis. So in talking to them, why don't they go get them? Because they don't want to leave work to go get a mammogram, okay? Or when they're out of work, they have to go bring their own children to the doctor, so they just don't have time. So then the organization said, well, we'll make time. You could go during work. And we'll be okay with that. Still not very high participation. And then the organization said, what if we would donate a mammogram to a person in your community that doesn't have insurance? So for every mammogram that we have, every participant that goes to get a mammogram, we're going to donate that out into the community. And think about the impact of a hospital being able to do that. That's huge. So then they ended up having 92% participation in women getting mammograms, because people do want to be able to help other people. And second example, an organization that was doing a company-wide step challenge. What they learned from their employees was they wanted to be able to donate to the charity of their choice if they won. So in doing that, they had over 90% participation. So that just shows you that even people that make $10 an hour want to be able to give back. So being able to really understand your employees, what motivates them, is really an important component in developing your wellness program. The culture of health has to begin at the top. So it's not okay to roll out your wellness program from your HR department or from your wellness committee. It needs to come from your executives and your CEO. So these are things that all of these communication tools are developed by SHS. We give this to you as part of your program. We make sure that you do have these tools available for you, but we highly recommend that when you're rolling this out, that the message comes from the top. And then it's just important to make sure that employees know exactly what they're getting themselves into. What does the program consist of? What do they have to do to meet their incentives? And make sure that they know that at the very beginning, and continue to give them information. Here's a coaching. Here's how important coaching is. We draw people back to the portal, to different trackers as the program goes on. So ongoing communication is so important. And then lastly, these member success stories. Here's Letitia, who you met at the beginning of this presentation. People are inspired by their colleagues. So another thing that SHS will do is we'll go out and we'll interview these individuals, we'll publish them, we'll put them on the portal, we'll put them in the newsletters, so to make sure that people are seeing the success of their colleagues as they continue to move through this program. We have our own programs. If you're a hospital, you may have these programs as well. We have a First5 weight loss management program that, we have a large grocery store chain that rolled this out last year. They had over 70% complete the program, and an average of almost 5 pounds lost per individual, and in a 6-week program. That's a pretty high percentage. These programs can be adopted by you as hospitals, or we bring these out to you as employers. Also a very highly successful tobacco cessation program that we have, that again we can train your coaches on if you're a hospital, or we can administer ourselves. And lastly, if you are a hospital, a reseller program, SHS provides even more employer-focused sales and marketing tools for you. So we help you identify your market, and we help you identify those self-funded employers. Once those employers are identified, we put together newsletters for you. We host health fairs and events for you to invite those employers to. We will create a menu of services for you. Here's an example of a hospital in Texas that this is their overall menu of services. that they're trying to sell along with their wellness. So they have a sleep center, behavioral health, sports medicine, and then on the right side is their wellness menu of services, and all of this was created by SHS. And as you can see, they have a health risk assessment, biometrics, claims. Those are all things that SHS does, but you'll never know it because it's private labeled to Valley Baptist. So we continue to bring sales and marketing tools. We'll do the PowerPoints for you. We'll do specific program guides for each employer. So you don't go at it alone. We are 100% behind you. So with that, I'd like to close with just really saying that the impact of a wellness program is really built around these three things. Online mobile tools, which is really a robust engagement tool, which we showed to you earlier. Having that trusted support by your coach is not only going to get the member healthy, but it really does drive down your claims as we showed today. And then ongoing clear communication, understanding what your population is looking for, what their barriers are, and creating that culture of health through communication. So that wraps up our webinar for today. I hope this was very helpful for you. I am more than happy if you reach out to schedule a demo for you or provide any additional information. So I'd like to say thank you for everyone who participated today, and have a great and healthy day.